If a patient or resident is found to be positive for Candida auris, healthcare personnel must place the individual on the right type of precautions to prevent transmission. Depending on whether the person is a patient in an acute care hospital or a resident in a nursing home, the type of precautions differs. In an acute care hospital, a patient who is positive for Candida auris must be managed using standard and contact precautions. Healthcare personnel caring for these patients must wear a gown and gloves when entering the room and for all interactions that may involve contact with these patients or their environments. Personal protective equipment, or PPE, should be removed before exiting the patient's room to avoid pathogen transmission. These patients should be placed in a single patient room whenever possible. When single rooms are not available, facilities may choose to cohort patients with Candida auris. Facilities may choose to place these patients in a dedicated wing or unit and dedicate the healthcare personnel who provide the most regular care to the patients. Dedicate patient care equipment to each patient, or use disposable single-use supplies. If specialized reusable equipment must be brought into the room of a Candida auris patient, careful and thorough cleaning and disinfection with an EPA-registered List P disinfectant is essential. When a patient is on contact precautions, any movement outside of the room should be done for medically necessary purposes, and the receiving department should be made aware of the patient's Candida auris status. If you need to travel with the patient on contact precautions for Candida auris, here's what you need to do. Before leaving the room with the patient, have the patient put on clean clothes or a gown, clean their hands, and ensure that any infected or colonized areas of their body are covered or contained. Remove and dispose of contaminated PPE and perform hand hygiene. When you arrive at the destination, like radiology, perform hand hygiene and put on clean PPE, a gown and gloves, before assisting the patient. In nursing homes, residents with Candida auris should be managed using standard precautions and either contact precautions or enhanced barrier precautions, depending on the facility policy and local public health recommendations. Contact precautions are recommended in the following situations: when acute diarrhea, draining wounds, or other sites of secretions or excretions that are unable to be covered or contained are present, as recommended by public health authorities during an investigation of a suspected or confirmed outbreak in a unit or facility. If the resident has another infection or condition, like scabies, norovirus, or C. difficile, or condition for which contact precautions are recommended by CDC guidelines. If these criteria are not met, the resident should be managed using enhanced barrier precautions. When caring for residents on enhanced barrier precautions, healthcare personnel should wear a gown and gloves during high-contact resident care activities, like dressing, bathing or showering, and transferring. Additional resident care activities that warrant enhanced barrier precautions are listed on the Enhanced Barrier Precautions signage or can be found on CDC's Enhanced Barrier Precautions guidance. When it comes to room assignments of residents with Candida auris, just like in acute care, private rooms are ideal. When this isn't possible, private rooms should be prioritized for people at higher risk of transmitting Candida auris to others, like patients with uncontained secretions or excretions, draining wounds, and acute diarrhea. In general, residents on enhanced barrier precautions are not restricted to their rooms, and they can participate in group activities, such as meals or social gatherings. However, all wounds must be covered, body fluids must be contained, and shared equipment and any items that the resident touches should be cleaned and disinfected after use. Residents should also be encouraged to use alcohol-based hand rub or wash their hands. In a nursing home setting, if residents are in shared rooms, facilities should implement strategies to minimize transmission of germs between roommates. This includes maintaining a separation of at least 3 feet between beds, using privacy curtains to limit direct contact, dedicating equipment or using single-use items when possible, increasing the frequency of environmental cleaning and disinfection, and promoting healthcare personnel compliance with hand hygiene and PPE use. As with all healthcare settings, if someone tests positive for Candida auris, they should remain on precautions while in a healthcare facility. Oftentimes, people remain colonized with Candida auris for many months, and in some cases, for life, even after an infection has been treated and resolves. Repeat screening is not recommended for people colonized with Candida auris. There is no known treatment to reduce or eliminate Candida auris colonization, so the Centers for Disease Control and Prevention recommend continuing enhanced barrier or contact precautions for the entire duration of all healthcare stays, current and future. It's important that the patient or resident's chart be flagged for Candida auris so the appropriate precautions can be taken. Alcohol-based hand rub is effective against Candida auris and is the preferred method for cleaning hands in healthcare settings when they are not visibly soiled. If hands are visibly dirty, they should be washed with soap and water. Hand hygiene should be done during the following key moments: before donning PPE and immediately after doffing PPE, before patient contact and after patient contact, before an aseptic procedure, after touching patient surroundings, and after body fluid exposure risk. To promote hand hygiene compliance, keep adequate supplies readily available. Alcohol-based hand rub dispensers should be easily accessible right at points of care and in shared or communal areas. If you feel that your facility needs additional dispensers installed, work with your facilities department to install them according to local fire codes. Candida auris can persist on surfaces in the healthcare environment for days to weeks. It has been cultured from multiple locations in Candida auris patient rooms, including both high-touch surfaces near the patient and surfaces farther away from the patient. Candida auris has also been identified on mobile or reusable equipment that is shared between patients, such as glucometers, temperature probes, blood pressure cuffs, ultrasound machines, nursing carts, isolation carts, and crash carts. Such contaminated surfaces may be an important source of transmission. Candida auris can form both wet and dry biofilms, making it harder to remove from the environment once it has been introduced. Therefore, strict adherence to cleaning and disinfection are key for preventing transmission. This must be done with the right disinfectant. Not all disinfectants are able to kill Candida auris, so it's important to use one from EPA's List P, antimicrobial products registered with the EPA for claims against Candida auris. If these are not available at your facility, disinfectants in EPA's List K of registered antimicrobial products effective against Clostridioides difficile spores can be used in the interim. However, it's important to note that quaternary ammonium products, known as quats, do not kill Candida auris. For any disinfectant, follow the manufacturer's instructions for use, including the contact time and whether PPE is required to safely use the product. Contact time, or wet time, is the amount of time that the disinfectant must remain wet on a surface without being dried or wiped away to effectively kill the germs. In summary, patients with Candida auris in acute care hospitals should be managed using standard and contact precautions. Nursing home residents with Candida auris should be managed using standard precautions and either contact precautions or enhanced barrier precautions, depending on the facility policy. If residents are in shared rooms, facilities should implement strategies to minimize transmission of germs between the roommates. Patients and residents with Candida auris must remain on enhanced barrier or contact precautions, depending on the healthcare setting, for the entire duration of all inpatient healthcare stays. Alcohol-based hand rub is effective against Candida auris and is the preferred method for cleaning hands when they are not visibly soiled. Facilities should dedicate patient care equipment or provide single-use equipment for each Candida auris patient. EPA-registered disinfectants with label claims against Candida auris, or at a minimum, an EPA-registered hospital-grade disinfectant effective against Clostridioides difficile spores, should be used to clean and disinfect. Thank you for listening today. This video is part of a 10-part video series on Candida auris. To access additional videos, please visit the Candida auris video webpage at health.pa.gov/c-auris-video. For questions about Candida auris, please contact your local health department or call 1-877-PA-HEALTH.